Now, still on this story, of course, with lockdown now a thing of the past, but we're told by government that some restrictions will remain. So what now for employers and employees going forward? Let's discuss this with human resources specialist at Global Business Solutions SA, John Botha. Mr. Botha, good afternoon, and thank you very much for your patience. I saw a commentary by you where you say there are a number of things that employers now still need to be aware of and do, although the national state of disaster is on its way out and we're still waiting for the new Health Act regulations. What are these things that employers must still do even after the termination of the national state of disaster?
Thank you, Dan, and good afternoon, listeners. Look, the reality is that employers are now front and center. So the Code of Practice on managing COVID-19 at the workplace has now been published and becomes effective today. So what it really means is employers with more than 20 employees have to firstly conduct risk assessments. Secondly, they've got to draft plans that results in the mitigation of any COVID-19 risks. Thirdly, they've got to consult on those plans. And then fourthly, implement them. And very, very importantly, the previous speaker mentioned the issue around mandatory vaccinations. And what is very important is employers have got a clear obligation that if their risk assessments dictate mandatory vaccinations, they've got a clear procedure to follow in order to implement that.
What risk assessment? So they need to look at everything, where they are in terms of their industry, as you said, and how many employees they do. What do they need to still keep in place? I mean, what considerations must go into such a risk assessment?
What's really important with the risk assessment are things like sharing of equipment, proximity to people, public transport, ventilation, and of course people's comorbidities and their vaccination status. And what we see now, the Code of Practice specifies that employers need to establish their employees' vaccination status so that that can be overlaid on the risk assessment. And as a result of that, companies can take informed decisions. It's a criminal offense for organizations that have got high levels of risk not to implement mandatory vaccinations, as an example.
Yeah, so if you have frontline workers, you got cold face-to-face interaction with customers and clients, you need to really be aware of what is happening. And from a planning perspective, do you plan now or do you wait for the new regulations of the Healthcare Act that the Minister of Health, Dr. Joe Botha, was speaking about a little bit. I think the submissions by the public for comment is until the 16th of April. I mean, it would be easy, I guess, to plan well, you know, what kind of regulations are going to be in place in terms of the Health Act.
Dan, that's a very good question. So we were expecting the state of disaster to only be lifted on the 15th of April. The President surprised us last night. As a result of that, Dan, the Code of Practice on managing COVID-19, which applies to employers, that started at 1 minute past midnight this morning. So the regulatory framework for employers is no longer a mystery. They've got to comply with the hazardous biological agents regulations and the Code of Practice. The National Health Act, that will be a matter that focuses primarily on the public, primarily on COVID as a notifiable disease. As far as employers are concerned, Dan, there's no doubt they, from today, have to comply with the Code of Practice and the hazardous biological agents regulations. You know, the National Health Amendments, they can follow later on, as you've said, but they will have a very small impact on the employment requirements.
And consultations, I mean, there's consultations and then there's consultations. Are these like all stakeholders for that employer need to be consulted? If there's a trade union in place, it needs to be consulted, or a workers' forum in place, it needs to be consulted. It's customers, or what's the universe like of the consultation for the employer?
Then, yeah, for the employer, the universe is certainly, from a procedural point of view, once the company has conducted a risk assessment, before they make decisions on ventilation, compulsory vaccinations, and other types of mitigating factors, they have to consult firstly with trade unions that are sufficiently represented. and secondly, with their health and safety committees. So employers have to go through that protocol to ensure an inclusive approach. If they miss that out, Dan, and then later on require mandatory vaccinations and employees challenge them, they'll be found wanting and will probably lose those matters at the CCMA or the Labour Court.
So whatever you decide to implement, it has to be post these steps that you've clarified, Mr. Botha. So implementation, therefore, will be easy and effective and efficient. Just on a practical thing, with this new change now from midnight, as you were saying, Ella, 1 minute after midnight last night, as an employer today, we are indoors, we're supposed to wear the mask. So as an employer, you still have to ensure that inside your business, people are wearing masks, sanitization, and 1 meter social distancing and things like that, that the employer still has to enforce.
Dan, that's correct. So we've got the 30-day, what they call the 30-day transitional period. So the wearing of masks, gatherings like at stadiums and the like, border protocols, as well as the compensation fund for people who suffer loss and damage as a result of vaccination, those continue for the next 30 days. So as you said correctly, indoors, you have to wear your mask in a public place indoors. Obviously, when you're outdoors, it's not necessary as long as you maintain your 1 meter separation. Then the big question, of course, is after the 30-day period, will we then be required to wear masks indoors? You know, after the 30-day period, if everyone's vaccinated in your studio, would everybody have to wear masks or not? The answer to that, we will have to wait for after the next 30 days because we're waiting for the National Health Act, the amendments to the National Health Act, as you indicated. However, having said that, Dan, if your risk assessment indicates that there are potential high levels of risk, even if you're vaccinated, I still believe organizations would be well positioned to consider wearing of masks in certain situations.
Would it be a wise thing? I mean, it's still not even day one. We were just, less than a day since this new change happened. Whatever an employer who's listening now currently have their measures in place under, of course, the old national state of disaster, level 1 lockdown, which finished at midnight. If you're not sure, you should still err on the side of caution until you've done your risk assessment before you suddenly change everything magically like that. Am I wrong, Mr. Botha?
And what is required is that organizations need to continuously redo their risk assessments because their situations change, their configuration of their businesses change, we get more data, we get new legislation. So what organizations need to do is continuously do that risk assessment and then update their workplace plans. As we get more and more information on the effectiveness of vaccinations, as we get more information, as the previous speaker spoke about, as we start getting critical mass and we start achieving higher percentages of vaccination, employers can potentially start relaxing some of those requirements. But for now, we're still in the middle of it.
Yes, and make sure you've got a proper risk assessment. Thank you very much. John Botha, he's, of course, HR Specialist at Global Business Solutions, SA. Some of the views about what now for employers, now that we are no longer in a state of national disaster, and we're still waiting for those new regulations under the National Health Act that's going to come later on. And